Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome to Bad to the Bones podcast. I'm your host, Debbie Rohde. On today's episode, Dr. Rahul Shah joins us to talk about common back issues and spine health. Dr. Shah is a board-certified, fellowship-trained spine surgeon who has patients seeking his care from all over the world. He's a recipient of the Wayne Southwick Award for Leadership in Spinal Surgery. Dr. Shah specializes in treating conditions and injuries to the neck and the back, including stenosis, herniated disc, and radiculopathy from the spine. Welcome to the show, Dr. Shah.
Oh, thank you for having me.
Yeah, we're really excited to get into some issues with spines, the spine, neck, and back. It seems like that's a lot of common issues people have, especially as we're aging. But let's start with who Wayne Southwick is and how you won that award. That's pretty interesting.
Yeah, that's a great question. So I did my training in orthopedics at Yale, and the former chairman of Yale was Wayne Southwick. He's since passed, and he's the one that invented the Smith-Robinson-Southwick approach to the neck for common neck procedures. So I learned from him on how to do that procedure, and been very lucky to be able to follow in his footsteps. And every year, for the folks that go into spine surgery from Yale, those that demonstrate the ability for exceptional leadership within that field are given that award. And so I was the recipient of that year.
Is that a standard or common procedure that you do often?
Yeah.
That he invented?
Yeah.
Okay.
So, when you do surgery on the neck to help people that have problems within the neck, where, say, they have a problem that's affecting the spinal cord or things that are pinching nerves in the neck, which can lead to all sorts of challenges like neck pain or pain that shoots into the shoulder blade, headaches, pain in the back of the neck, or pain that goes into the fingertips. That is often taken care of through an approach where we make a small cut within the front of the neck.
Okay.
And the approach on how to get down to the spine and how to move all the vessels around and how to take the pressure off the spinal cord was described by him, and his work initially showed how it can be done reproducibly. And when they were doing that at that time, they didn't have all of the same technologies that we have, including MRI scans and other ways of being able to really find challenges within the nerves being irritated or compressed within the spine. So he was a true pioneer in his field, and it's truly an honor, and I'm humbled to be able to carry on that torch.
Yeah, that's definitely a well-deserved award, it sounds like. Not something giving to your average individual studying. What sparked your interest in becoming a spine surgeon?
So when I went into orthopedics, I thought I just wanted to help people live their lives. I wanted to help people enjoy their life. And to be very frank, I found that the aspect of being able to help somebody sit up and stand up was amazing, and to walk again.
Yeah.
So I initially thought that I wanted to go into total joint surgery because I wanted to be able to do hips and knees and things of that nature.
Yeah.
And that was my initial intent. But when I went to Yale, and I worked in a lab there with Dr. Manohar Punjabi, and he's probably one of the world's foremost eminent researchers in biomechanics of spine. We did a fair bit of work, and that's when I really got a chance to understand the spine. I understood that in general, all the principles that apply to hip and knee surgery apply to spine surgery. And the principles of trying to get the joints to move in a harmonious manner, to make sure that the muscle strength was preserved around the joints, to make sure that the alignment was maintained, and to take away the areas that were irritating the individual, either the bones rubbing together or maybe a nerve getting irritated, were universal principles, and they came together in such a beautiful and harmonious way when it came to the spine. The other thing that I found so impressive about the spine itself, and what really drew me to the spine, was scoliosis. Now, scoliosis is something that we think about for many kids, right? Like, I have a niece or a nephew that has a curvature in their back, and maybe they had to wear a brace, or maybe they had to be monitored.
Yeah.
But what I found was most touching about that condition was that my dad had scoliosis. What's interesting about that is that he never knew he had scoliosis until he was older, because he was always told, oh, when you were young, you fell down.
Oh, wow. So it kind of throws you off balance?
It throws you off balance, and it gives you a deformity. When one shoulder is higher, one hip is higher, the spine twists. And it's a tough situation because it's something you live with, but everybody sees that you're not perfectly straight, and it can weigh on you, and it can weigh on your ability to do things on a day-to-day basis. And it's a condition or a state of being that's a little bit difficult, and I found that was quite troubling, although you can't always, nobody wants to be in pain all the time, and nobody wants to complain about their pain all the time.
Right.
So it was a combination of understanding how the spine works, seeing how the spine twists, seeing how it had a unique draw to me that really drove me to go into spine surgery.
Interesting. What do you find is maybe more on the difficult side for your patients to understand about spine care in general? Can't see it, it's behind us type of theory that I know you talk about, or it's inside of us.
Yeah.
Can you kind of elaborate on those three things?
Yeah, I certainly can. One of the challenges I think with spine is that because it happens all the time and it's there, it becomes a very lonely existence because nobody else can see it.
Yeah.
So you're going through it, and it's not there all the time in every position, but it's there enough of the times that it distracts you.
Yeah.
So let me give you an example. So let's say I take my hand and we get a cut on it. You can see the cut. You can see where the cut is. You can see how deep it might be. Maybe if you put a little bit of alcohol on it, it'll burn. Mm-hmm. Or maybe if you put a bandage on it, it'll stop.
Yeah.
So you kind of understand that. But what happens in the back or the neck, it happens in a spot that you can't see. It's literally hidden to us.
Yeah.
So there's a lot of judgment that has to be made about that. You can try and describe it. Oh, my neck hurts, and then sometimes, my shoulder blade seizes up, and oh man, my shoulder keeps pinching, when it's all part of the same thing. Mm. Or you know what, my fingers keep going to sleep, or I keep dropping things, but it's not my hand, it's my neck. Like, these things are not easy to understand because we don't come with a roadmap or a manual say, oh, if you have this problem, look over here.
Right.
So we have to sort of put the pieces together to figure out where things are. So much of spine care takes a little bit more diligence because you're trying to fit together puzzle pieces. Now, if you've ever done a puzzle.
I love puzzles.
It's
That's
like
my favorite pastime. Puzzles and a glass of wine.
Oh, well, there you go. So when you have those puzzle pieces, they all look like they fit, right?
Yeah.
It requires a lot of judgment to see, do they fit right? And so what do? You got to work off of a model to be able to understand it. Otherwise, you'll put together puzzle pieces, but they either may not fit or they fit and make the wrong picture, and then all of a sudden you have something that doesn't quite fit.
Yeah, absolutely.
So understanding that is good. So when I talk to my patients about trying to get an idea of the puzzle pieces that figure out where the spine is or what the spine problem might be, there are a couple of basic tenets that I use. I said, we need to understand what's going on. You can describe it, but don't feel pressured to use all the right words.
Yeah.
Because sometimes if you say my pain is here and it's a burning pain, my burning might be your pins and needles, and your pins and needles might be my cold water pain, which might be your hot fire pain. They're all true descriptors. It's hard to get that out. So I think one part is the description, and then the other parts are trying to see how it affects your activities. I have tough time doing this, that, or the other thing.
Do patients have a difficult time explaining what their pain feels like or where it's kind of originating from?
I think that they all have a clear idea of what they want to say, but I think when other people try to understand it, there can be a disconnect.
Yeah.
So then they try harder to say, oh, no, I really mean this, like it's really there, but because you can't see it, there's the element of uncertainty. So what I like to do actually for my patients is I don't even dwell on their descriptor. I hear what they say, and then I show them pictures of what spine pain might look like, and I let them make the call of which one fits you the best. Because just like a puzzle piece, I want to see what fits the best.
Yeah. That's an interesting approach because it sounds like you kind of leave an open picture and give them a few pieces to fit in there.
Right, but we try and make sure that we are working together towards making sure they fit right. So there are other pieces of the puzzle that we look for are x-rays, particularly with you standing up, because I want to see how gravity affects it or how their posture is over time. MRI scan sometime to look at actual nerves or discs or things of that nature. Maybe a CAT scan and maybe a nerve test. Those are sort of the workhorse ideas of where we look for to try and see. And what we want to do is we want to limit the amount of error of fitting the pieces together by using each of the individual modalities, X-ray, physical description, MRI, things of that nature, to support each other so that we're more likely to know that this is the problem and not something that's similar to it.
So I know that you share a lot of tips across the national media news outlets, basically about posture and just back and spine health. If you could elaborate, maybe share with our listeners the importance of how the muscular health is related to the spine. Would that be a proper question to?
Yeah, no, I think that's an excellent. And I think that the muscle we can't see. I mean, everybody knows if somebody looks muscular or not, but when you go to any spine professional, say, a physician, pain management person, physiatrist, neurologist, orthopedic surgeon, neurosurgeon, they may deal with the spine, but because we can't reliably measure how good the muscles are around the spine, it becomes difficult for us to counsel people.
Yeah.
And yet, in my practice, what I've seen is that those that tend to have the best muscular health, particularly as they age, they're able to weather challenges that result from the spine. So then the question becomes, how does that work? Mm-hmm. And the way the back works and the way we interact with the world whenever we go to sit up or stand up or get in and out of a car seat or get in and out of a chair or go to pick up a paper clip, we're always bending, twisting, and torquing to get to that area. And it's whenever you move your torso over your pelvis or your head over your torso, you're always moving through the hinges that hold those things together. And if you are not efficient in the way that you use your muscles to move those hinges, it's possible for those hinges to get more stress or more difficulty and potentially not to hold up to that level of stress that they're getting. And in that space, the better that you have formed a mind-muscle connection, the more rigid or robust that muscular strength is, the more you will be able to effectively navigate that challenge. Because the truth is that it's very easy to hurt your back if you're not mindful in the way you move, and we have so many friends and relatives, and maybe even ourselves, that have gone through that scenario. And in order to make yourself able to handle the challenges that you may face, having a more efficient or pure movement through the spine may help to prevent or reduce the types of injury or types of irritation you might experience through the neck or the back.
So when you say muscular health, I hear a lot of people talk about, core strength, got to keep a really strong core, and that helps support your back. Is that a real thing?
That's a real thing. And I think that it's a real thing, but it's not the only thing.
Yeah.
So if you think about the way the low back works, and you're saying, what muscles can I work on to try and work around getting my strength of my core? The reality is that functional movements are very important, right? Mm-hmm. Moving through being able to open up your hips, or trying to go from sitting to standing, or going from a deep squat to being able to stand up. Those are tough movements and those are difficult movements, but those are the movements that we rely on a day-to-day basis, not only for sitting and standing, but to get us out of a jam if we find ourselves falling or something of that nature. And so in order to try and be able to increase the core strength and things of that nature, working on those functional movements is helpful. And working on standard types of exercises to increase core strength may be one piece of the puzzle, but another piece of the puzzle may also be to incorporate slower movements where we're increasing the muscle strength of those functional aspects, including things like yoga or yoga with weights, which I call Pilates, and things of that nature, to really help with being able to optimally use the loads on the muscles and not the bones and the joints, because we want our ability to withstand those pressures to be concentrated in those areas.
So with a lot of people working from home now, they most likely don't have ideal workstations and proper chairs to sit in. Are there some tips that you might be able to share with our listeners that they could use to help maintain good posture, or does that kind of play into how you were just describing Pilates and core strength and such?
Yeah, no, I think that's an excellent question. I think that the first issue is, yes, of course, those principles of core strength and Pilates are timeless. But now I'm used to maybe working at an office desk, or I'm used to working in an area where I have a more controlled environment, and now my environment is a little bit less controlled. How can I handle that?
Yeah.
And in that scenario, my general advice is to first start with doing stuff outside of the desk environment. Make sure that you're staying active. See, when you go to the office or potentially go to work, there's a reasonable chance that you had to walk in the morning to
Right.
get ready together.
Exactly.
Walk to your car, walk out of your car, potentially go up and down a flight of steps.
Yeah.
And all of that is priming your muscles to be able to handle the business of sitting down. So if you are going to be working from home or doing these things called Teams meetings all day,
Yeah.
you're going to be sometimes irritated by just sitting in one spot, because your attention is so sucked into the meeting that you may not be able to pay attention to the other portions of the physical toll that sitting is there. But I don't want to turn sitting into a demon. What I
Yeah.
want to do is say, that is a necessary load I have to face.
Right.
What can I do to enhance my ability to be prepared for it? Walking is probably the most simplest exercise that you can do to increase the blood flowing to those areas. And then when one sits, it's a good idea to try to have the pelvis sort of stacked, with the lower back stacked on top of that, and then the torso stacked on top of that, and then the neck and the head stacked in sort of a straight line, but not one where one is too far back or too far forward.
That's like your Jenga theory, right?
Yeah.
You like to, is that it?
Yeah, so it's like a series of blocks, right? And you want to make sure that all the blocks are in a reasonable spot,
Yeah.
because you don't want things to topple,
Right.
because you're too far craning one way or another. And I think that's one of the things that we want to do. But I think that if you are going to be on Teams meetings all day, or if you are going to be sitting in one sort of posture a day, and you don't have a sophisticated chair, or you don't have an adjustable height desk or things of that nature, try and see if you can make breaks, almost like movement type snacks, if you will,
Yeah.
where you're doing something to try and either do stretches or a light walk or a light cardio routine, maybe every few hours, because that will not only help to break up the monotony, but it will also help to increase the blood flow to the areas that need it.
Yeah, I think it might even be a good idea for people to set an alarm,
Yeah.
every 30 minutes or so, because I know myself, I'm at my desk and I'm stuck at my desk doing work, and if I have a few minutes break, I pick up my cell phone and I'm going through social media, and then I'm like, gosh, I got to get up.
Yeah.
So we kind of get stuck in our spot. So yeah, that's definitely good information to have. If you think about the top 3 spine conditions that you see often, what would they be? And could you share a little bit about what each is?
So a lot of spine conditions do blend together. So I'll give you some 3 basic categories, but they're all sort of interrelated. I see a lot of folks that have herniated discs. Those may be either in the neck or the low back. That's a common term, but it's really just an area in the spine where the spine moves, where that area is wearing out and potentially worn out in a spot where it's irritating a nerve.
Yeah.
And we take care of that. So herniated discs, along with that, we see people that have a lot of radiculopathy, or pain that goes down the nerves as they branch out of the spine. That's stuff that goes into either the hands or into the legs or into the shoulder blade. So those are 2 things. And then the third thing that we see a fair bit is the people that have what's known as stenosis. And what that basically implies is there's a lot of reasons for it, but it's basically choking off of the nerves as they run through the different channels within the spine. So if there's stenosis in one of the channels, it can be called one type of stenosis. If it's in a different channel, it'll be a different type of stenosis. But those are the 3 main types of problems that we see as spine surgeons.
And so if a patient comes in, with all of these symptoms, what would be the initial assessment? What would the initial assessment process look like?
We want to make sure that we're dealing with the right problem. If we can understand the problem, and this is a firm belief that I have, if you understand the problem well enough, the solution's obvious. I learned that in training, and that's always been a motto that I've kind of gravitated towards. So if someone comes in for an initial consultation with myself or my team, and I'm surrounded by an absolutely wonderful team. We have intake folks that make sure people come in and we have a good idea of what it is that they have. We have medical assistants that help to make sure that people get their questions answered and that people feel comfortable the whole way through.
Yeah.
I have physician assistants that work with me and myself, and we all work together as a team,
nice
collaborative.
collaboration.
Yeah, and really everyone has their own set of responsibilities that really makes it a truly world-class experience.
Yeah.
But as we go through it, when someone calls and they talk with one of our operators have a very good idea of understanding what might be the best fit. If someone doesn't have all the testing, we don't want them to wait a few weeks to see me and then for me to start the testing process. We'll get them in right away to begin the testing process to make sure we have a clear understanding of what the challenge is.
Okay, so they'll come see you first, and then you'll evaluate, and then they'll get testing,
or me or one of my team, right?
Okay,
and
yeah.
we'll get that together. Now, if someone's already done a fair bit of testing and they've done things, we want to make sure that we find the right option. Listen, all I do is spine surgery.
Yeah.
And most people that I see, we really don't talk about surgery if we can avoid it. So we're
Right.
always trying to make sure that surgery is the best choice. Surgery is a tool, but you want to use the right tool for the right problem at the right time.
Yeah.
And everybody in our team is trying to make sure that we make that fit ideal.
So do you take a different approach with acute versus chronic pain and conditions?
Yeah, I do. And what I really take a different approach is the magnitude of the problem.
Yeah.
So if someone has a acute problem, which sounds like it's a bad problem, but in my world, acute means new and chronic means old or long-lasting. But if you have a long-lasting ability to not walk more than 5 feet, that's a significant problem.
Yeah.
If you have an acute problem of only not being able to run 10 miles, but you can run 9.5, maybe you don't need surgery, right?
Yeah.
These are the things that we are trying to tease out.
Yeah.
So our goal is to make sure that we're almost like sugar and milk, where we're going in to just support and make the whole experience much better, all the way from being able to sit up, stand up, and do the things that people want to do on a day-to-day basis.
Do you feel like by the time a patient comes to you, there's some misconceptions that they have about what they can expect?
Yeah, so expectations is difficult. If you talk to anybody, should I get spine surgery? Oh, I don't know. It might not work. I mean, 50-50 chance.
Yeah.
Those numbers are used because there's not as much thought for that individual person. One of the real secret challenges, one of the secret things that we have at Premier, which is absolutely awesome, is that we have a great pain management relationship contingent. So we work very closely with our pain management folks. And so we get a very good idea from multiple perspectives of what the truth might be. What is not commonly understood is if someone gets an injection and they get relief for a few hours, not a few days, not a few weeks, not a few months, just a few hours, where they go from ow to, oh, that felt a lot better.
Yeah.
Then we can almost reliably get to that level with uncomplicated surgery of almost 85 to 90%. I mean, the results are actually quite shocking. And we're able to do that because we have found the problem, we have correctly understood the way to address the problem, and we are able to reliably get that done on a consistent basis.
That's great. I mean, I think it's a scary process when someone comes in with back pain and not knowing what to expect, and you go on the internet and the next thing you know, you're dying. So
Right.
you try to self-diagnose yourself. So it sounds like your approach is very thorough. Have there been some new advancements in technology or techniques that you are pretty excited about?
There's a lot of things that have changed in spine that I think have real impact. There's a lot of technology advances, but the ones that have impact, I think, are pretty stellar, and let me just touch on two of them. One is for overall posture understanding. Because we're understanding how to be able to understand what someone's true posture is, we're using artificial intelligence and machine learning to be able to design custom implants for people so that we're able to really dial in their posture to the best of our ability based on not only that person's experience, but hundreds of people like that in their experiences. It then allows people to stand up straight. In fact, it's interesting, even though there are some people where we put in lots of rods and screws, the folks that tend to have the best results with spine surgery don't look like they've had surgery at all because they're able to move effortlessly, particularly after surgery. And thankfully, with these advances, we're able to get to that level in a more predictable manner. And the other thing that we've been able to work with is some more minimally invasive ways to be able to correct posture or handle challenges that were either said, oh, sorry, you're just going to have to live with it. And so we're able to work with that spectrum better. And that's really purely from not only just the technology, but from our collaborative effort with the whole team, including our pain management physicians, our physician assistants, and our other surgeons that we all work with, and our non-operative specialists.
When the decision has been made between you and the patient to consider surgery, what is that conversation like in terms of, just getting the patient to a comfort level of what they can expect after surgery?
So it varies
or in
from
choosing
person.
surgery, why it's a good time to choose surgery.
Yeah, it varies in person to person. So let's talk about the timing of surgery, and then let's talk about the expectations around surgery. So with regards to the timing of surgery, if somebody has a problem that's getting out of hand, it's like anything else. If you take a cup of water, right, and you sort of tip it over a little bit, there's a little bit of a trickle. But at some point, that trickle can turn into a pour, and that pour will pick up its own steam. When someone's problem turns in from a trickle to a pour and starts to pick up its own steam, then we know it's time. And that's why we follow our patients carefully to make sure that we understand that.
Yeah.
And then when the time is ready, we're there. And most people always have, in no circumstance that I can think of have I said, oh, no, you must have the surgery, and the patient has refused.
Yeah.
In reality, we've always approached that as an option, and then we show why it may or may not be the option, but it's always their choice. And if they want to have the surgery or they don't want to have the surgery, they've always made the right call in my experience. So that's about the when to have surgery. Then it's the what can I expect from surgery. And we'll give them pretty clear guidelines. Listen, for this surgery, the results are not great because this is the one that has the worst predictability. For these surgery, the results are fairly good because it has this type of predictability. And then if folks want to have other folks to talk to, we certainly have a roster of folks that we certainly talk to from time to time that are happy to let other people know about their experiences so that people can understand what we're able to achieve.
Do you find that some of your patients are just so at their wits' end with their pain that they come in and say, I just want to have surgery. Can we just do surgery?
Yes. Yes. And those are the people that they really tug at your heartstrings because your goal is to try and help them as best as you can. And it's one of those things where you still have to be very true to the process and true to the rules of being able to make sure that you have a clear understanding of what their problems are. Frustration is not a reason to do surgery.
Yeah.
A reason to do surgery is something that we can clearly help someone with in a manner that nothing else will likely help, and we've clearly identified the problems, and we've shown that surgery has outperformed doing nothing. And in those people, we're certainly more than happy to help show them where that's coming from.
So what do some of the non-surgical treatments look like?
Well, I think that some of the non-surgical treatments look like maximizing a whole host of additional options. And the range on that is a little bit broad, and that's why I hesitated. But let me kind of take a stab at it to try and give you an idea of what I'm thinking. On the one hand, it's doing exercises, physical therapy, and Pilates type work.
Yeah.
For some people, chiropractic care can be a useful adjunct. For others, maybe it's occasional medication along with the first two.
Okay.
For some people, it's acupuncture along with the first two.
Yeah.
So it all depends on what things are and what the state of the condition of the person is and how fragile they are. We want to make them as robust as we can with the strengthening that we do, and we want to help them be comfortable in their symptoms as we can.
So is physical therapy a big aspect of non-surgical treatment that you would try?
Physical therapy is certainly a very important principle that we try. And one of the things that we have with our physical therapists and the physical therapists that we collaborate with, because we have people from all over, is our goal is to make sure that we're supporting them in what they need to do. And so in many ways, physical therapy isn't a black box, it's an integral step. And what we're starting with is introducing folks to maybe get some basic conditioning done before they get to physical therapy, and then work on more advanced maneuvers with physical therapy so that they use their physical therapist not only as their guide, but as their coach for personalized feedback on how to optimize their day-to-day living, their day-to-day rituals, or day-to-day stretching, or their day-to-day exercises.
So we know, well, some of our listeners may not know, but you have experience that attracts people from around the world to come to see you for care, which is phenomenal. I mean, that in itself is just phenomenal. What would you say sets you apart and attracts people from around the world to come see you?
I think that it's impossible to know for sure exactly what people find. I think that what we have here, which is special, is our ability to listen to what people have. And because I think it's so difficult to explain what someone goes through, I take the approach of putting all my cards on the table.
Yeah.
Yes, we do techniques that not many people do. We've pioneered some minimally invasive techniques. We've taught surgeons, myself and my team have taught surgeons around the world to do certain different types of procedures that are minimally invasive. But it's not the procedure that tends to drive people to just come to me. It's the experience, and I believe it's our outcomes. And I believe alongside of that, it's the fact that we are committed to seeing that we do the best that we can.
Is there a memorable case that, stands out for you?
There are so many. I mean, there was one of the things that I ask my patients after surgery is, was it worth it? It's a difficult question.
Yeah, I'm sure.
It's a difficult
question. How far
question.
after surgery do you ask that?
Sometimes the day after, sometimes the week after, sometimes the month after.
Yeah.
And sometimes the answer is, we don't know yet. We're not sure. I'm not sure. But many times it's yes. And then I say, well, it was worth it because fill in the blank. Mm-hmm. And some of those are stuff that I can't understand.
Yeah.
Like, it was worth it because I can pick up my 2-year-old again. What do you say to that?
Yeah, I mean, that's a big thing, or it was worth it because I can walk up the steps. I mean,
Right.
You're right. I guess it's kind of, in the grand scheme of things, what's most important to the person.
And sometimes it's worth it because I can go and do Formula One racing. I mean, like it can be any of those things. And which one is it, right? So those are the things that have to be taken into context. And it's easy for me to say one story is more important than the other.
Yeah.
The truth is that they're all important, and our goal is to serve people as best as we can.
What do you do what helps you stay current with the advancements in technology and the different techniques?
I am incredibly blessed to have friends from all over the world. Now, these friends are the heads of many of these institutions, heads of many of these societies, and they're at the forefront. There are some people that I worked with that are the heads of big research facilities in Germany or in Paris, so we have folks from all over the world that we collaborate. And so, for me, that unrelenting drive to be able to do the best that I can, so that I can help somebody enjoy their life better, faster, quicker, in a less pain-free manner, and not have to go through a big hump with any type of surgical intervention. That's a calling that helps me to stay engaged. Mm-hmm. And instead of saying, oh no, there's another thing to learn about, the truth is, whenever I see that, my first inaction is, oh, well, how can I use that? How can I use that to help somebody? And sometimes it's not the best fit, and I'm not going to go very far down that road. Yeah. But sometimes it can be a game changer in a way that wasn't even intended.
So with your finger on that pulse, do you find that there's more advancements in technology or technique?
Probably both, because the technology advances introduces technique advances that you then sometimes can use in other areas. You're like, wow, I could use this technique over here that I never thought to apply. Okay. So it's sort of like an interwoven journey. But I think that the biggest is that we're able to more reliably find problems that we saw, but we didn't recognize.
What would be your best piece of advice that you would give to up-and-coming surgeons interested in focusing on spine?
I think the piece of advice that I would give is the piece of advice that served me the best. And whenever you're confused about the solution, focus on the problem. If you understand the problem, the solution's obvious. I learned that when I was in my when I was at Yale with Dr. Punjabi, and he used to say that all the time. And I think that it's still probably the most prescient words that I use whenever I get stuck, because we can't see it.
That's a nice quote. Yeah, I mean, It's really it's short, but it says a lot, you know.
Yeah. Because one of the things that spine is a little bit more challenging with. Remember how I said you have to piece together the puzzles?
Yeah.
Sometimes the puzzle pieces aren't perfectly clear. They're a little bit like hard to see. And so in spine, it's easy to say, oh, I don't see a problem, therefore a problem doesn't exist.
Right.
But the guy's like, but I have a problem.
Yeah.
And now all of a sudden, am I crazy? How many people do you know have spine problems?
A
So
lot.
I don't ever address that question of if anybody's crazy. Being crazy is your problem.
Yeah.
My problem is to be able to see what I can do to help understand how I can support you.
Right.
And
There's all
that's
kinds
it.
of crazy.
Yeah.
Yeah.
So I don't know that, because the truth is I have no way of understanding it.
Yeah.
But what I can do is be absolutely committed to finding out what the problems might be and what we might be able to help someone get back to what they need to get back to.
I like that process. That's very good. Well, thank you, Dr. Shah, for being with us today. And
Yep. Thank you for having me.
you know, you really provided us a nice comprehensive look into what we cannot see.
Yeah.
So we appreciate you being here. If you or someone you know has some back issues, whether it's acute or chronic, please reach out to us. You can text us or call us. We really pride ourselves in access to care. You can reach us at 856-690-1616 or schedule an appointment online at poasnj.com. Thank you for joining us on this episode, and we look forward to seeing you and having you listen next time. Until then, stay healthy and active. Have a great day.